Juliet Campbell.
In your chairship today, and I thank the honourable member from North Ayrshire and Arran for her thoughtful opening remarks, and I pay tribute to all of those affected by breast cancer, those facing diagnosis, their families and friends and carers who stand beside them. It is their experiences that make this debate so very important. And to my constituents of Broxtowe for signing this petition. I also thank the petitioner for starting the petition in the first place. I do welcome the government's ambition for the National Cancer Plan, and it commits the NHS to ensuring that by 2035, 75% of people diagnosed with cancer will be cancer-free and living well after 5 years after diagnosis. The plan will also develop further AI-assisted interpretation of images for suspected breast cancer diagnosis and will help us to detect breast cancer for women under 50, those with a more dense breast tissue. Under the last government, cancer performance targets have not been met since 2014, leaving too many women facing delays and poor health outcomes. However, I know that my constituents in Broxtowe want this government to go further and to include women aged 40 to be routinely invited for breast cancer screening. Because according to Copperfield, cases of breast cancer in under 50s is on the rise. And a recent report states that we've seen a 5% increase in the last year. Patients under 50 are more likely to have their symptoms missed and are more likely to be diagnosed at a later stage in their cancer journey compared to those over 50. This issue is even more pronounced for women from minority and ethnic backgrounds and for those from deprived and rural areas who have less access to screening opportunities within their communities. Therefore, additional public health attention needs to be paid to this. And according to breast cancer research, there are 10% more likely to begin treatment after the cancer has already become invasive, as well as being 20% more likely to require a mastectomy. So to achieve our cancer outcome aspirations, I asked the Minister to extend routine mammogram invitations to women from the age of 40, and I hope the Minister will also consider the rollout of alternative diagnostic measures that will affect the diagnosis of younger women.